started on a date yet. But this one's kind of the foundations of gut health, and then the next part of the series is going to be about brain health, mental conditions, and how that relates to the gut. So I always have to put a disclaimer in here. This is just for informational purposes, and so not to be taken as specific recommendations without consulting your doctor. Okay, so today we're just going to have an overview of the gut, talk about the function of the gut, and talk a little bit about the gut-brain connection. And I see some familiar faces, so some of this might be a little bit of review for you from the brain health workshop that I did. We'll talk a little bit about the gut microbiome and inflammation in the gut and how that relates to the systemic part of your body too. And then we'll do the kombucha demonstration and the tasting. So people ask, like, what is the gut? And basically the gut is the digestive tract or the gastrointestinal tract. And it's basically just a long tube. It goes from the mouth all the way out through the anus. And it includes everything from the mouth, the esophagus, the stomach, large and small intestine, but also includes these other organs here, the liver and the gallbladder and the pancreas. Those help with aiding in the digestive system. It's about 30 feet long altogether when it's all spread out. So it's pretty intertwined and very specific depending on where in the digestive tract you are as far as function and structure goes. And so what is healthy digestion? Some people, they're so accustomed to how their digestion works that sometimes they don't realize that it's not as optimal as it should be. So this is kind of just a review of what is considered a healthy digestion. And I like this quote that I got from this functional medicine doctor, Russell Jaffe. He says that everyone should eat foods that you can digest, assimilate, eliminate without immune burden. So we'll talk about what that means here. But basically, people should be having at least one bowel movement a day. And the stool should be easy to pass, it should be formed, it shouldn't require a lot of straining, a lot of time sitting on the toilet, and it should feel complete after you're done. And a healthy transit time should be about 12 to 18 hours. So if it's too fast or too slow, that can be a problem. And I kind of reference Goldilocks here because it's like you don't want the stool to be too soft or too firm or too watery or too hard. It has to be just right. And looking at the quality of the stool is really important because that gives us an idea of how healthy our digestion is and how well we're absorbing our nutrients and everything like that. So as naturopaths, we always talk about the gut and tell me about your stools. What does it look like? What is the color of it? Like, we get into all those details. So, and it's kind of surprising that some people don't even really look at their stools. But it is a really good reflection of how you're doing digestively. And so the digestive system is part of the autonomic nervous system. And there's two main branches of that nervous system. There's a sympathetic branch, which is the fight or flight nervous system where you are in a state of stress and you're trying to decide, should I stay and fight this bear that's attacking me or should I run away? And with this system, your blood circulation is shunted from your digestive system to your muscles so that you can run away and get away from danger. And the parasympathetic nervous system, this is my dog Yoshi. He's an example of someone that's nice and chill and relaxed. And that's the ideal way that you want to be when you're digesting your food, to optimize this parasympathetic branch of the nervous system. Because if you're too stressed while you're digesting, then your body's not going to do as great of a job at digesting and absorbing the nutrients than if you were in a nice relaxed state. So, and these are just some ways that stress has a physiological effect on your digestion in the gut. So it actually can decrease gastric secretion in the stomach. It increases gastric motility, so maybe instead of 12 to 18 hours of a transit time, it's down to 6 or something like that, so you're not absorbing as much. It increases mucosal permeability and impairs the gut barrier, which we'll talk about what that means. And also because it's you're in that sympathetic state, it takes blood flow that should be coming to the digestive tract to aid in absorption, and it pushes that to like the muscles instead of the digestive tract. And it can have an effect on the composition of the microbes that live in your gut. And by doing that, it decreases the diversity of the different species that are in your digestive tract. And it can also affect neurotransmitter production, such as serotonin and the happy hormone, and can actually increase sensitivity to foods. So digestion. So digestion actually starts in the brain and the mouth. So when you look at your food or you're smelling the scent of something nice and yummy, it gets your brain thinking about what you're going to be eating, and that sends signals to your salivary glands in your mouth to start producing the acid to help with digesting the food. And it involves the vagus nerve also, which we talked about in the brain health workshop, how that's one of the gut-brain connections, because it's coming directly from the brain and stimulates the digestive tract. And so it primes the rest of your digestive tract to that food is coming and it needs to start working, so it's primed for digesting your food well. And so some of the tips that we give to almost every patient is chew your food. So it should be chewing about 30 times per bite. And most people, they chew maybe 10, 15 times at the most. Because a lot of people are on the rush, they're eating in their cars, or at their desk, or what have you. So they're not always eating in a relaxed environment. And they're often rushing through their meals. So it's good to remember that it impacts your digestive ability when you're not in a relaxed state when you're eating your food. So, and mindfulness too, that helps to remind you to engage your brain in what you're doing too, thinking about what you're eating and helping use that to prime your digestion too. And then, so now we're going to talk about the gut mucosa. So basically, the mucosa is the mucous membrane that goes all the way from the mouth to the anus. It also lines the nasal cavities and things like that too. It's the first line of defense from the outside world. So kind of like our skin is the first line of defense against trauma and things like that. The digestive tract is the first one to come in contact with the outside world, meaning like the food that we're eating, what we're ingesting in our body. And the structure and function of the mucosa changes depending on where it is in the digestive tract. So maybe there's more mucus-producing cells in one organ versus another, and like the small intestine is designed for more absorption, so the surface area is different in that, and the structure of that mucosa is going to be very different from like the large intestine, which is more of a storage organ. But the health of the mucosa is very important because it aids in absorption of nutrients and also prevents the passage of harmful molecules from entering the rest of our systemic circulation. So this is an example of a healthy mucosa. So here is if we're looking at a cross-section of the wall of an intestine, this would be the inside of like the stomach of the small intestine. And then these are the cells that line it, and then the basement membrane, which is like the connective tissue. And then here is the blood cell blood flow going at the base of it. And so you can see that these cells are very tightly packed together, and they have what are called tight junctions here that keep the cells really closely sealed together so they prevent passage of foreign substances that shouldn't go through those cells and enter the bloodstream. And so you can see that these microvilli here, I kind of think of this like shaggy rugs, like the longer strands of the carpet. And on those little fingers there are even smaller microvilli because it's increasing the surface area for absorption. So it's a highly absorptive system in the small intestine, but also very highly selective. So only allows very specific nutrients to pass through and tries to make sure that it blocks anything that's harmful from passing from the gut into our system. And then along with the mucosa, another really important part of the digestive system is the gut microbiome. And so it's important to remember that we are not alone. We're never alone. We always are accompanied by a huge array of different species in our digestive tract. We're actually outnumbered 10 to 1. Some people say 11 to 1 by our own bacteria. So, and it weighs 2 to 5 pounds, which is kind of gross to think about. But so welcome to the gut with the 100 trillion population. And so there's many functions of the gut microbiome, and this is, bedding research into this whole field. But they found that, it's helpful for digesting food and extracting nutrients, aiding in fermentation, breakdown of the food particles, immune modulation, maintenance of the gut barrier, helping to keep that nice and healthy, and there's two strains of probiotics that I mentioned there, the bifidobacteria and the Saccharomyces boulardii, that are really important for preventing endotoxin absorption, and we'll talk about that in a little bit. The microbiome also help to produce anti-inflammatory factors, produce pain-relieving compounds, and antioxidants, vitamins, things like that. So very multidimensional. But they also have an effect on the brain and mental health too. There was a mouse study that looked at, they gave one group of mice lactobacillus and another group of mice no probiotics. And they found that the mouse that had the probiotics were displaying less symptoms of depression. So there's definitely a link between mental disorders and disorders in the gut too. So what happens when the mucosa is impaired, and why is the gut so important to us? So this is what's called like leaky gut syndrome, or hyperpermeability in the gut. And so this is an example of a damaged mucosa. So in the other picture, the cells were touching very close together. In this one, the junctions between the cells are broken, and so that allows particles to pass freely through the digestive tract into our blood circulation. And from there, it has access to our immune system and can circulate throughout our body. So it is a pathway to inflammation in our body. So it's really important to identify if this is a problem and try to address it so that we can prevent development of other chronic diseases. So damage to this mucosa can lead to breakdown of the tight junctions between the cells and loss of that selective barrier, so things pass easily through and then can enter our circulation. So affecting joint health, our immune system, basically can spread inflammation anywhere. Zonulin, so that'll be in the next slide, I think, so we'll talk about that. So some of the causes of leaky gut could be, too much stress, how that could impact the mucosa. Poor diet is a big one. Some medications are harsher on the digestive tract. Eating foods that you're sensitive to, that you're not going to be digesting well or breaking down well, or allergies. Damage or trauma to the intestinal lining, infections are a big source. Dehydration, imbalances in the gut flora, and irregular bowel movements too can put a strain on it. So lots of different causes. And so zonulin is one type of molecule that they've discovered just, I think, within the last 6 years. It's a major trigger for actually opening those tight junctions and allowing for leaky gut syndrome to take place. And this is just one molecule that they discovered. There's probably a lot of other ones that they haven't identified yet. But this one is stimulated with gluten and also microbes in the small intestine, which should be fairly sterile. So microbes that shouldn't be in there can also trigger zonulin. And so zonulin, it kind of opens a doorway to the gut junctions and inflammation in the gut. And actually elevated zonulin levels have been linked to elevated zonulin levels in the brain too. So that blood-brain barrier that we talked about in the brain health workshop, that can also be impaired with higher levels of zonulin circulating in your system and leading to mental health conditions or neurological issues that are tied to the gut too. So possibly some underlying cause for brain diseases out there. And then endotoxins. So this kind of works with the zonulin. So if the tight junctions are open, it can allow this uninvited guest to pass through and enter our digestive system and leak through our mucosa and cause a lot of irritation and inflammation. So endotoxins are these fat-soluble extensions off of these gram-negative bacteria that when the bacteria dies, it releases this endotoxin that gets absorbed through our digestive tract and into our bloodstream. And the reason that's so problematic is that it causes a activation of our immune system and can lead to some autoimmune conditions and definitely inflammation. And it's been associated with high levels of it have been associated with cardiovascular disease, chronic inflammation, diabetes, type 2, dyslipidemia, obesity. So very common conditions that a lot of the American population suffers from could possibly be related back to this uninvited guest. So it all kind of goes back to the gut. So we always try to look at, what is the gut health looking like? What are your digestive symptoms? Are you having any issues with that? And then figuring out how we can best address those things so that we can optimize that gut mucosa barrier. So that's why when we're as clinicians, when we're kind of stumped and there's a lot of different health conditions that someone has, we're not really sure where to start with them. It's a reminder for us that when in doubt, treat the gut, because it always comes down to that. And also a reminder that food is our medicine. So food is what we thrive off of, where we get our nutrients from, our energy. And so remembering that when you're trying to figure out if you're eating something and you're not tolerating it well, maybe it's not the best food for your system. And then linking back to a leaky gut as the underlying cause for inflammation and then many chronic diseases. The nice thing about the gut and the digestive tract is that there's a rapid cell turnover rate, and I think it's like every 3 days or so that the cells are proliferated in the digestive tract. So there's a lot of healing potential there, that you can replace the damaged cells, and once you get rid of the source of inflammation, it can repair that gut lining and help to calm down inflammation. And then just sort of going back to the endotoxin absorption too. So it's always one of the top priorities that we always focus on as naturopaths. So another ND tip that we like to give is to try to identify and eliminate food sensitivities. Sometimes that can be like a night and day change that can happen in someone once we eliminate those food allergies or food triggers as far as symptoms go. Trying to eat a whole foods diet, limiting refined sugars and processed foods, and staying well hydrated, and then feeding your microbiome. And I highlighted these two because of that. They actually have been shown to decrease endotoxin absorption through the gut. So keeping your population of these two probiotics in your digestive tract helps to prevent that endotoxin absorption. And also because the endotoxins are fat soluble, they tend to be absorbed easier if you're eating like a high fat meal. So if you combine it with lots of phytonutrients from green leafy vegetables or really colorful dense foods, it can help to inhibit absorption of the endotoxins as well. So there's tools and tricks that we can do to help to prevent that endotoxin absorption, and making sure that we can support our microbiome is one of the things that can be really helpful. And kombucha is a nice way to do that, and as well as fermented foods too. So now Dr. Gonzalez is going to talk about kombucha.
Can I ask a question about that? So there's a lot of GMO foods that are out there now. Is that related to things going on in your gut?
Yeah, it definitely can. It can cause irritation in the gut lining. It actually changes the structure of the food. Like wheat that we eat today is very different from wheat we used to eat like 30 years ago, because once they introduce the Roundup and things like that, it changes the molecular structure of the proteins in the wheat, so it makes it more antigenic, so more inflammatory and harder to digest. So it definitely can impact our gut.
So the best way to go is to eat organic.
Mm-hmm.